speak about hypertension, the most important part of how to manage the hypertension. As we all know that hypertension is a leading cause of mortality across the globe. If we go to the data, we can see that more than 10.4 million lives are being lost per year to hypertension. So although the prevalence of hypertension is increasing day by day, many patients are underdiagnosed and undertreated. If managed well, these patients can prevent various complications of hypertension. The primary aim of therapy for hypertension should be effective control of blood pressure in order to prevent, reverse, or delay the progression of the complications, thereby reducing the overall risk and individual without compromising the quality of their lives. Having assessed the patient and determined the overall risk profile, management of hypertension proceeds as follows. In low risk patients who do not have any strong risk factors associated with hypertension, like they are not diabetics, they do not have obesity, or they do not have any strong family history of cardiac disease, we have to begin with lifestyle modifications and we have to observe for a period of 3 months before deciding whether to initiate the drug therapy or not. So we do not have to jump to the treatment straightforward in low risk patients. It's important for the treating physician to assess the risk factors of the patient. If deemed to be low risk patient, give a trial of lifestyle modification that has to be done for a period of at least 3 months. And if we are not able to control blood pressure despite adequate steps taken to modify lifestyle, then we have to initiate the drug therapy. In medium risk patients who have got associated comorbidities, like those patients who have a family history of cardiac disease, or those patients who have got hyperuricemias, or those who have got early stage of diabetes or dyslipidemias, again, we initially have to give a trial of lifestyle modification for at least 2 to 3 months. If the BP still remains more than 140/90, then initiation of drug therapy is deemed appropriate. But in very high risk patients or high risk patients, these are those patients who already have coronary artery disease, or those patients who already have suffered stroke or have had any vascular event. In such group of patients, it is appropriate to start immediate drug treatment when they are diagnosed with hypertension. So now coming to the measurement of blood pressure. As we all know, there is a notion in the minds of people that, taking BP recordings at home is not the appropriate way of diagnosing hypertension. But with the new research, with the new data, and with the new guidelines, it is mandatory for every hypertensive patient. It is good for the patient to have his blood pressure checked at home also, because the outpatient office measurements, they at times can be misleading. And we miss a subgroup of patients who basically come to the hospital and they have masked hypertension. We don't diagnose it in the office, but the patient continues to have elevated blood pressures when we check his BP at home or we go for ambulatory blood pressure monitoring. Especially with the advent of ambulatory readings, that is the ambulatory blood pressure monitoring, which reflects more details about the hypertension, and we can also assess the risk of BP, hypertension mediated organ damage. So out of office recordings can differentiate between white coat hypertension with elevated office measurements and masked hypertension where the office measurements are low. Now, the reduction of blood pressure, the gradual reduction of blood pressure is prudent therapeutic approach except in the stage 3 of hypertension. It would seem desirable to achieve optimal or normal BP in young and middle-aged patients. In the diabetic subset of patients, it is advisable to achieve the blood pressure goal of less than 130/80. Or in patients who have had stroke, it is again desirable to achieve the BP goal of less than 130/85. And at least high normal BP in elderly patients, where the goal can be relaxed to at least 140/90. There have been many studies, aggressive approach versus lenient approach. So the debate is still on and the jury is still out. But still, we can give a relaxed target to the elderly patients where we have set it to 140/90. Antihypertensive therapy should achieve and maintain the systolic blood pressure below 140 mm of Hg and the diastolic below 90 mm of Hg, and lower if tolerated by the patient, while controlling other modifiable risk factors, which includes dyslipidemias, which includes obesity, and other medical conditions if patient has got any. Lifestyle modification is essential for managing hypertension, and optimal treatment starts with diet and activity. Dietary changes include salt reduction. It's a very important part. Moderation of alcohol consumption. binge drinking should be avoided, and a diet high in vegetables and fruits that is low in added sugars and saturated fats. Activity recommendation includes aerobic and resistant exercises for at least 30 minutes or more, at least 5 days a week. Other important modifications include cessation of smoking and reduction of stress. Adherence to the antihypertensive treatment is one of the major issues because, as we all know, that hypertension is a disease that has to be managed, and the patient has to take the medications at time lifelong. So adherence to the treatment still remains a major problem, a major issue, and poor adherence to these medications leads to development of hypertensive complications and the increased risk of cardiovascular events, which in turn reduce the ultimate clinical outcome. So, adherence to the antihypertensive medication is the main predictor of treatment success and effective step in controlling blood pressure and preventing its complications. Now, coming to the question of how frequently a patient who is diagnosed with hypertension should visit his physician. So, if you have a high blood pressure and you are being started on the drug therapy, you should see your doctor at least once in a month until your BP goal is achieved. If you reach your blood pressure goal, then you can relax your number of visits, and you can visit your doctor every once in 3 to 6 months, depending on whether you have other diseases such as heart failure, coronary artery disease, and if you have diabetes and have had any history of heart attack or stroke, I mean to say any vascular event, then you need to be in a more closer follow-up because the hypertensive treatment goals are more strict and more important in that subgroup of patients because if the treatment is not done properly, there can be complications and there can be mortality. High blood pressure monitoring. So this is a question that is very important. It is the self-monitoring tool that can be incorporated into the care of the patient with hypertension once they are diagnosed with hypertension. Their home blood pressure monitoring is a very important tool nowadays, and it is recommended by almost all the major guidelines. A growing body of evidence supports the benefit of patients' home blood pressure monitoring compared with office-based monitoring. These includes improved control of blood pressure because you are aware of what is your blood pressure range while you are at home, when you are relaxing, when you have done any physical activity, and it also helps in diagnosis of white coat hypertension and prediction of cardiovascular risk. So if we adapt this practice, if we follow this practice where we are adherent to the treatment, where we are doing a proper home blood pressure monitoring in our patients, they are cooperating with this, so we can achieve our targets. We know that our patients are aware of about their blood pressure levels, and this way we can control, we can manage the complications, and we can definitely reduce the mortality. So this is a message for all. BP, hypertension, that is elevated blood pressure, hypertension, is a disease that has to be managed, and it can only be managed by following a healthy lifestyle, by eating a healthy diet, and by being adherent to our treatment that has been initiated by our physicians. And definitely, we should every patient with hypertension should adapt this practice of doing home blood pressure monitoring so that we are well aware of our blood pressure range and we are able to control and manage hypertension. Thank you.